Most of them have asked most of my questions. I'll try to make it short, make a little bit of a statement. I've been in education for 40 years. I've seen a lot of words put into protecting our kids from drugs, opioids, marijuana, all those. And we don't seem to do a lot about it. And I'm glad, Dr. Murphy, I heard you say something about education. And after 40 years of experience, that's what it's got to be done. We've got to put education, we've got to put money behind it. And it's getting worse and worse. Now that we've opened our borders, it's going to get even worse. And I feel for our kids, I really do. They're looking for something else, something different. Again, dealing with 17 to 24-year-olds for 40 years, it's different every day, but we got to find an answer. We got to find a solution, because it's not going to get any better by just saying it'll go away on its own. We're losing 50 to 60,000 kids a year dying of overdose. And we talk about COVID, and it's our biggest problem now, but we have to do something. Now, I live in Alabama. We've lost 14 rural hospitals in the last 10 years because we're losing nurses and doctors. We don't have enough. We don't have enough hospitals to take care of our patients. Dr. Murphy, for you, other than telemedicine, which we're using, what can we do? The thing about it, the only thing we have now in our rural areas is our pharmacies. And now those are starting to go under because, if you think about it, that's really our hospital and our doctor and our consultant for healthcare in rural areas. But these PBMs are absolutely putting our pharmacies under because there's a middleman between the drug companies and the pharmacies, and they're taking all the profits. But what else can we do in the rural areas?
Well, Senator, I think this is such an important point, and I realize that the challenges that you're speaking to in Alabama are likely being experienced in other rural areas in our country too, that you're struggling without enough healthcare providers, and they're watching rural hospitals close down as well. There are a couple of things, Senator. In addition to telehealth, which you mentioned, the couple other areas I think we need to focus on is on strengthening our rural health workforce, where we see often clinicians get trained and then they relocate or stay in urban areas, and we don't have enough nurses and doctors in rural areas. But we can address that, I believe, through a combination of the National Health Service Corps, using the United States Public Health Service Commission Corps more effectively, and expanding their role. I think we can do more there. But the other place where I think we can do more, Senator, is in supporting the rural hospitals themselves. I think the cost structure in rural areas, as you know, is different for healthcare than in urban areas. And you have to sometimes put more into base infrastructure to serve a smaller population, because that is the nature of rural areas. If we apply a one-size-fits-all model to rural and urban areas, then rural areas will come up short, and they won't get the support that they need. I think we've got to recognize that and build that into our funding support models as well.
Yeah. Thank you. Dr. Levine, you've worked in mental health. And of course, being a football coach and an educator, I worked in mental health for 40 years because I see a lot of it. You know what I'm talking about. And we seem to be, over the last 10, 12 years, more and more problems with mental health with our young people. What do you think is the answer to that? I mean, what's the first direction in your job would be to overcome some of that?
Well, Senator, thank you for that question. We do share a concern about young people and their mental health. At Penn State Hershey Medical Center, I ran the adolescent medicine program, where we saw many young people with medical issues as well as mental health issues. I think that we need to work on prevention, and we need to work on access for treatment. I think we need prevention programs to prevent mental health problems in our schools. I think we need prevention programs in our communities and community health centers as well. And I think we need to increase access to treatment, whether that's in urban areas, suburban areas, or rural areas. We need more mental health professionals. We certainly need more child and adolescent psychiatrists, but not only psychiatrists. We need psychologists, psychiatric social workers, and really the whole spectrum of mental health workers to be able to treat our young people who are suffering from these mental health issues. Basically,
what you're saying is we need a plan.
Yes, sir, we need funding.
We need funding, we need a plan, and I've never seen that in mental health. In all my years in being around kids, we had to look for somebody to help with mental health problems. One other question, Dr. Murphy, you've been through this job one time. What's your #1 priority that you feel like that you can do better at this time?
Well, sir, I have had the privilege of serving once before, you're right. And the reason I'm back, Senator, is because my priority first and foremost is to address COVID, to turn this pandemic around. There are issues that have been worsened by COVID, mental health and substance use disorders. And those are my accompanying priorities as well. But we've got to turn this pandemic around first and foremost. Sir, to me, this is very personal. I've lost 7 family members to COVID. Most recently, my uncle in Dallas a few weeks ago. I look at my children, who are, my older one, my son is doing remote learning as well. Desperately wants to be back, with other kids, but can't. And there are many families I know that are struggling much more than we are. I want those families to be able to get back to their lives. I want our kids to be able to get back to school. I want people to be able to go to work and not worry every day that they're going to catch the virus and get sick. I want us to be able to come together as a community again, Senator.
Yeah.
That's what's brought me back to public service. It's why I hope to have the opportunity to serve our country once again.
And both of your jobs are very important. And COVID is, I've lost friends. It's sad what we've gone through. We can see the light at the end of the tunnel, but we've seen drugs and mental health problems just continue to soar. We have to put money in education. Dr. Veen, I think Levine will agree with me on that. We have to do something about it. We can't continue to say it'll go away. COVID, hopefully, we will get it to go away. These other two, they're not going anywhere. And it's all about educating our kids at a young age, and not starting when they've already had a problem. Thank y'all today. Thank you very much. Thank you, Mr. Chairman.